because of early detection and treatment. The incidence was at 25.13 per 100,000 population, and this is as of 2017. Again, I mentioned that the number of new cases has significantly decreased over the years. In 2018, we were at 197 new HIV cases, which is the lowest record over the last 10 years. Newly diagnosed cases in San Francisco tend to be more inclusive to women, persons of color, and drug injection users who are not necessarily classified as men who have sex with men. Funds allocated for prevention programs and treatment seem to be affected, as we see a decrease in new cases and decreases in diagnoses among whites and males, and men who have sex with men who are injection drug users. The decrease in incidence is not inclusive in all demographics equally, as I had mentioned, and this may be because of the emphasis of these prevention programs being on the historical at-risk groups, in which other demographics are currently maybe ignored or not as emphasized, for example, the Latinx community. Prevention measures. So historically, San Francisco has proven to have effective prevention efforts and methods from day one. With the data from the first diagnosed cases in the early 1980s to date, there has been effective prevention measures in which members and government officials implemented policies and methods. Also, public health officials and the research was used to raise awareness in a timely manner from when the epidemic began. Recording large number of cases was also a major asset in prevention and control of HIV. As I mentioned, the surveillance method used has been in place for a while. So San Francisco is one of those cities that are looked at nationwide as having effective preventive methods. So small studies have been conducted showing prevention interventions and the effectiveness in small group discussion and counseling. There was a recorded reduction in the rate of gonococcal proctitis and rates of anal intercourse. There has also been community mobilization led by community members of the at-risk population. Driving force for HIV prevention has raised awareness effectively. So same members that are part of the at-risk population has been a voice for all other at-risk members and have been able to prevent further infections and reduce the number of newly HIV diagnosed cases. The San Francisco Department of Public Health also funds intervention and helps increase knowledge of safe sex, substance use, control, and how to build self-esteem. I just feel as if now we would need to kind of expand to the newly populations at risk. The San Francisco Department of Public Health also intensifies HIV prevention efforts in communities with heavily concentrated at-risk individuals. It expands in targeting efforts to prevent HIV. It expands HIV testing to help lower the number of new HIV infections. It expands prevention activities with those HIV positives, helps in maintenance of care, and promoting holistic approaches to health that includes the prevention of HIV-related co-infections such as Hep B and C. Some barriers that San Francisco is currently facing, again, is income inequality, the lack of health insurance, and homelessness. I feel as if homelessness kind of ties everything together because homeless populations face income inequality, lack of health insurance. Those that are facing income inequality, are at risk of becoming homeless and not having health insurance. So it's all a little cycle. According to the San Francisco Department of Public Health, the percentage of people diagnosed with HIV who are currently experiencing homelessness continues to increase. We can compare a significant 20% in 2018 to an 11% in 2016. That's only a 2-year difference. The homeless community in San Francisco tends to be only 33% virally suppressed compared to a 74% general comparison to the city. So again, income inequality, the lack of health insurance need to be addressed if the goal is to control HIV, AIDS, and its new cases. And I feel as if homelessness is going to be the main factor to help reduce transmission, to help reduce the number of new HIV cases. So my proposed intervention plan, again, my target is homelessness. So having a structural prevention should be implemented when one is at risk of becoming homeless, in which residents can turn to. So having structures or centers across the city that these individuals can turn to and maybe like check in, meanwhile looking for employment and stability. Early intervention should be mandatory for all early homeless individuals. So we are trying to have social groups and mentoring accessible so they can get back on their feet and prevent them from becoming permanent homeless individuals who are at risk of HIV. There should be ongoing flexible support required if need be, such as counseling, group therapy, peer support, etc. And this will kind of help maintain these individuals out of the homeless stage and provide them with continuous therapy, education as to how to maintain themselves economically and efficiently. Lastly, stakeholders and local government can help address the issue to the utmost potential by providing structures, by providing food, and providing health care to the homeless population at risk. Again, a lot of these individuals who are newly diagnosed don't necessarily have the ability to go ahead and test or go ahead and receive treatment right away. Homeless individuals don't necessarily also have the ability to be on PrEP, to if they are at risk because they are men who have sex with men and are homeless, they are facing double the risk and maybe not necessarily have any education. So targeting this particular at-risk population, and for me, it would go ahead and help reduce the number of HIV cases in San Francisco, and this would just be the first step. We want to make sure that we are lowering transmission in the city as a homeless maybe transmitting the disease a lot quicker than other individuals in the city or at-risk individuals and communities. So that would be my opinion and my proposed intervention plan to public health officials and government and local government in the city of San Francisco. So these are my references. If you have any questions, definitely feel free to reach back out to me and I'll be more than happy to assist you in answering any questions that I can. Thank you.